Welcome to my channel. So today I'll be talking about diuretics, for example, furosemide, and we'll be talking about the nursing aspect of these medications or the nursing responsibilities. So as a nurse, first of the things we have to assess is the patient's vital signs baseline, cell blood count baseline before therapy begins, so that we're able to monitor this any significant changes that might need to be reported immediately. It's also important to check the baseline test results for the liver function and levels of the serum electrolytes, carbon dioxide, magnesium, band, creatinine, and they should be reviewed periodically. The other important thing is to assess for any signs of excessive diuresis. Such signs include hypotension, tachycardia, poor skin turgor, excessive thirst, cracked mucous membranes. We also have to assess for edema and ascites. On ambulatory patients, you can check on the legs, and for patients who are on bed rest, you can check the sacral area, but also generally the patient's body has to be assessed for any signs of edema and ascites. So the other thing, we have to weigh these patients every morning after they void. We have to weigh them in the same clothes using the same scale, and this will help us to ensure that the medication is working. Some of the nursing implementations that as nurses we have to carry out is to monitor the patient's intake and output. Since these medications' purpose is to get rid of excessive fluids out of the patient's body, so we have to monitor their intake and output carefully every 24 hours. It's also important to give the medications to the patients in the morning hours, so they don't have to wake up late, especially at night, to wake up to go to their toilet or to use their commodes. So if the patient has to take this medication in the evening time, it's good to give it before 6 p.m. so that by the time the patient goes to bed, their bladder is not full and they can sleep comfortably and not have to wake up all the time whenever they feel the urge to urinate. So periodically, nurses have to check the liver function tests. Safety is very important when a patient is on these medications, especially ambulatory patients, when they are getting up or they are walking due to dizziness. Since diuretics cause the excessive excretion of potassium, it's recommended for nurses to consult with the dietitians to ensure if a patient can get potassium supplements, and also keep urinals commode close to the patient, or if a patient is in bed and they need help to get up to use the washroom, to ensure that their call bells are in reach. What are some of the things that we have to teach patients as nurses? Like I said before, encourage the patient to continue weigh their weight every morning, same time, same scale, same clothes, and after they void. And this will help to ensure that the patient is not gaining unusual weight or unexpected weight rapidly. So also, we should encourage patients to eat potassium-rich foods and avoid high sodium foods. For example, lunch meat, smoked meats, processed cheese, things like that. Also encourage their patients to report immediately unusual signs or adverse effects of the drug. of the medication. For example, like chest, back, and leg pain, shortness of breath, increase in weight daily. Patients might gain 2 pounds, which is unusual for a normal person to gain that weight rapidly like that. If there is an increase in edema or like on the foot, on their hands, what are some of the nursing evaluations? To ensure that the patient's electrolyte levels are within normal limits, to ensure that the patient is continuing to maintain their hydration, to also ensure that the patient is adjusting well to the altered patterns of urine elimination. So in part B, I'll be talking about indications, actions, adverse reactions, and contraindications of diuretics, for example, furosemide. Thanks for watching, and subscribe to my channel. Hit the bell for notification of new videos that I'll be uploading. Like my videos and leave a comment. Stay tuned for more content.